So Botox is the trade name for botulinum toxin, which is a treatment for minimizing muscle movement and hence wrinkles. It's a very old treatment since the late 1980s when it was first discovered for the use in correcting squints, that is when the eyes were crossed. Ophthalmologists discovered that the patient's wrinkles were, as a side effect, reduced in the crow's feet area. So it's now been used for a wide number of reasons for patients who have either muscle spasticity, such as after having a facial paralysis. It's used to treat wrinkles due to excessive muscle motion, either in the frown lines, such as those, or the crow's feet area, in this area. And by reducing the amount of wrinkling or creasing of the skin, it allows the natural body's healing processes to reduce the wrinkle size and depth. Typically, the injection is given and the effect starts working after 1 to 2 days, perhaps building up to maximum effect after 10 to 14 days. Most practitioners doing Botox injections will treat the patient and give a follow-up appointment to adjust the dose if necessary. In terms of the safety of botulinum toxin, as I said, it's a drug that's been used for many, many years. Many millions of doses have been used internationally, and it is, by and large, a very safe dose. So in terms of the safety of Botox, this is something that people worry about a lot because its full name is botulinum toxin, and therefore people think of it as being a poison. And in actual fact, yes, it is in its original form a toxin, but in a very, very dilute form, almost homeopathic if you like. Many millions of doses have been given internationally since it was first approved for cosmetic use, and the drug has a very high safety profile. To give you an idea about the safety of Botox treatment, typically to treat a patient who's got, for example, deep frown lines, one would use somewhere in the region of between 15 and 20 international units of Botox. Now, the dose to treat a child with cerebral palsy who has spasticity or stiffness of the upper limb, one would typically use anywhere between 50 and 200 units. So it's got a very high safety profile, such that you would probably need to give somewhere in the region of maybe 10 complete vials of Botox in order for there to be any risk to a person's health. That's not to say there aren't some complications, such as injections which can cause the muscles to be weakened overly and therefore some asymmetry, but fortunately, again, the side effects are temporary. Immediately after injection of Botox, patients can expect a little bit of pinkness in the injection site, which lasts for a few hours, and a tiny bit of swelling as well, again for a few hours. The patients shouldn't go straight home to bed after treatment because by lying down there may be some changes in the distribution of the Botox which can cause some unwanted effects. As I mentioned before, it's a very safe drug, and therefore patients shouldn't be overly worried, but shouldn't overly exert themselves in the few hours after treatment. In terms of the effects of Botox, patients can expect after perhaps between 2 and 4 days for there to be a reduction in the amount of movement or sensation of stiffness in the area or heaviness in the area, and that will build up to a maximum at about 10 to 14 days when they should notice a pleasing reduction in the amount, depth and extent of any wrinkles or folds. Botox is typically used to treat the frown lines and the crow's feet wrinkles and perhaps the forehead. Very few people use it in the lower face because of the effects on the smile, apart from in the neck, where it can be useful to reduce the bands that form vertically between the midline.